My name is Rich Wicklund. I'm the CEO of BenefitsApp. Welcome everybody to our discussion. A couple housekeeping items. We will be recording the presentation. We'll make that recording available to people if they would like to see it. We'll also be sending a follow-up email with a one-pager about our health screening tool so that you can see that. I have on the call with me Jeanette Partlow, who's president of Maryland Chemical Corporation. It's a client of ours, and Jonathan Anders, who's a benefits industry expert. If anyone has any questions, please submit them through the chat. And at the end of the presentation, if we have time, we will respond to those. If not, we will respond to them by way of email or a direct call to you. But please feel free to submit any questions. I would like to just say that this is, we're all responding to COVID-19 in real time. BenefitsApp is a tool that is easy to use, easy to download, and we have developed a health survey tool with Jeanette Partlow, who's president of Maryland Chemical. And so we'll be getting her comments to begin with. We'll go through a presentation of the tool, and then we'll finish up with commentary from Jonathan relative to the industry, and then answer any questions. So with that, we will go ahead and get started. So BenefitsApp is benefits. We feel benefits made mobile or benefits made easy. Originally, we launched the tool as a platform for bridging the communication gap between open enrollment and when employees need to know their benefits throughout the year. The COVID-19 health screen is a feature that came about 10 days ago with Jeanette Partlow. She called and said, look, I have certain issues that I need to resolve. We think these issues resonated with others in the market. So we said, look, we're going to build out a feature within the Benefits app that's a COVID-19 health screen feature and work with you and your team to support you through people getting back to work safely. And so what I would like to do is just have Jeanette as a business owner, Maryland Chemical, 67-year-old family business located in Baltimore, Maryland. I'd like to introduce Jeanette. And Jeanette, if you could just reflect on your comments in our discussion the other day about what your needs are with your employees, I think it would set the stage for the rest of the presentation. So Jeanette?
Sure. Thanks, Rich. I'm Jeanette Partlow, president of Maryland Chemical. Like all of us here on the call, every day and every week has brought something new to learn about and, handle and navigate. And we are an essential business, so we never closed. We actually sell cleaners and sanitizers. And so I have an 18-person team, and some folks, as the guidelines came down from the CDC and the governor, some of our folks are able to work from home, but others are not. Our warehouse team and our drivers, they can't. And we also have to have some folks in the office. Very early on, we haven't had anyone who has been infected with coronavirus, but very early on, we had people who got a fever, had to stay home. Somebody's family had been exposed to another family member, and we kind of counted down the 14 days. And so we knew very early, actually it felt, well, it was scary, but early on it was like, wow, I'm glad we didn't have to anticipate this for months and months and then have the experience of what do we do. I think it was week 1, we were like, oh my God, here we are, what do we do? So in the beginning, we were just learning about, well, what do you do when this happens, in terms of an exposure. But then, as I would say in the last three weeks or so, we've been more focused on, well, the economy, more and more of it will reopen. We were anticipating additional guidelines and requirements for us to, in our case, remain open. But what new requirements might be coming our way that we need to be prepared for? And we were already hearing about the taking your temperature. I know that all of us, I guess probably going back to H1N1 and Ebola, those epidemics, we were all asked, as individuals at our doctor's office or dentist's office, some of those questions about, have you been to a foreign country and things like that. So the first thing that happened was our drivers at some of our customers started being asked the set of questions, and then the set of questions grew before, for instance, they would be allowed on certain sites. And so we were looking at what our customers were doing and, sharing the information, what our suppliers were doing, and realized that ensuring, the health survey, it's like, okay, how are we going to do this? Because it's sounding like this is going to be a best practice or a requirement or a recommended practice. How do we, and some of our customers, for instance, are 3 shifts, 24 hours. They have guardhouses. They have security teams. They have medical offices, things like that. Well, we don't have that. So I was really thinking about how can we get some help navigating the pandemic for our company of 18 people? Because as we all know, it's not, probably in the early weeks, we thought, oh, maybe this will just be a couple of months. Well, it's not going to be a couple of months. We're going to have to find something that, how do we take care of our people, our customers, our community, our company? How do we follow the CDC and the state guidelines as they are today, but also as they will be, as they may change in the future weeks and months? And then for us, because we're a small crew, how do we make this sustainable and repeatable for the long haul so that we can have something, have a process? At first I was thinking process, and then I started thinking, well, who is going to do this health survey? How are we going to do this? And then, in reading and thinking, I thought, well, maybe we can have a self-survey, which is when you go to the doctor's office, and our drivers, they were self-certifying to the folks who were asking them the questions. And that's when I thought to reach out to Rich and BenefitsApp. We are all about safety first. If we can't do what we do safely, we can't do what we do. We lose the right to do what we do. And it's very important that we say what we're going to do and then be able to do what we say. So I was really looking for, again, going back to the repeatable and sustainable for the long haul. And we also may have, the day is going to come when someone or some people, group, more than one person on my team, they're going to have to quarantine at home, either because they've been exposed to someone or someone in their home, or it's a suspected exposure. So let's say the supervisor's out, and in other organizations, it's a supervisor who may be taking the survey of the team members or the employees. So, what about when someone goes on vacation? And Lord knows we all need a vacation for sure. So I just was really looking for how can we create, what resources are available, what tools are available that we could make this repeatable and sustainable, and also at the individual level, have it be on each individual team member's top of mind. The stay safe practices that we have been practicing now for 9 weeks, 8 weeks, each one of us, on our team, every day we're talking about how staying healthy, part of staying healthy is going to be, we're relying on one another. We're trusting one another to, do what we're all being asked to do. And that helps all of us stay safe. So my goals were to find something sustainable, repeatable, regardless of who in the organization was there. So when I reached out to Rich, I said, well, can we make this a self-survey, like a survey that each person would take every morning, or, if you had different shifts every day, that would give an indication of, yep, come on to work, or nope. In any case, call your supervisor, but it really takes it down to the level of the person who knows. So that's how we got to where we are today. And Rich, thanks for, helping to, chart this course for us. I really appreciate it.
Well, thanks, Jeanette. I appreciate that background. Maryland Chemical is a great business in Baltimore, and you bringing this to us, as I said, this is real time. We are responding. Everyone's responding, and it's amazing. I'm starting to get survey this, survey that, and what we're trying to do is create that sustainable, repeatable process that, in particular, also is HIPAA certified, highly secure. We're dealing with very important information. And so when Jeanette came to me, again, 10 days ago, we have a platform that is can evolve rapidly. It's highly secure. It's based on, if you're familiar with the Salesforce Lightning Community platform, and it's highly scalable. We have clients with, small group clients up to large groups with 15, 16,000 or more members. And so I thought to myself, well, how do we respond to our clients' needs? And we're always looking to evolve our platform. And so we thought, well, okay, employees need a convenient tool that is self-serve that can help to convey their health status. We all wake up in the morning and say, all right, should I go to work or not? And it's a personal decision. Well, what we wanted to do is take the guesswork out of that and give the employee a way to know the answer. It needed to be sustainable, repeatable. And to Jeanette's point, this isn't just for a week, this isn't for a month, this is for the long term. And this needs to be reliable and something that's always available to the employees. Employees need guidelines. If I feel like I have a sore throat today, should I go to work? If I have a fever, what should I do? So we're using guidelines set by the CDC. As Jeanette mentioned, these guidelines are changing. It's an evolving process. So at BenefitsApp, what we are doing is we use those guidelines to create our platform and our process, but we then tune it to the employer's specific needs. So if you're in the health space and you'll see this in a minute, if you have a yellow score, do you go to the office or not? So these are certain things that we use guidelines, and then we can edit it, tune it to your specific needs. It has to be HIPAA compliant. And so people are providing information about their health. We need to keep that secure. They're providing it on a regular basis so that we can see trending data. So our platform based on Salesforce is HIPAA compliant, highly secure, highly available. So we check that box. We think it needs to be visual with clear direction so that people know if they should be coming to work or not. So we've adopted a red, green, yellow stoplight theme for, do I go to work or do I stay home or do I reach out for additional support? And furthermore, I'll mention at the end of the presentation, this discussion is going to continue. So next week, we're going to have a second webinar, which closes the loop. So Jeanette mentioned employees call to their supervisor, but what if their supervisor's not available or they don't want to share personal health information? We have a relationship with a company called TouchCare that's a healthcare advocacy that can do those follow-up calls and be proactive. More on that to come at the end, but also for next week. Once your employees submit this survey, how do you get that information? Well, you can log in anytime into a portal and see the results of the survey today, from yesterday, over time. And I think personally that, especially with certain funding that's out there and certain government related directives, we're going to need to see trending information as well as for our companies. So that will be available to you. And then furthermore, there's the employee follow-up. So lastly, the platform, sustainable, repeatable, but also supported. So at BenefitsApp, we provide full service, complete support of the process. And so that's part of how we go about doing it. So many of you probably are not familiar with BenefitsApp. So I'm just gonna take you through a quick slide. The user experience, you download the app from the app stores. It's available for Apple and Google. You register once. It's a two-factor authentication, salesforce.com. Once you log in, you have face recognition and you see your branded company within the Benefits app. You see your information, quick links, but also your benefits. So the COVID-19 survey is one part of a benefit system, benefit package. And so all of that information is right there available to you at any time. And we customize that to your particular needs. So we typically work with your human resource department or your broker to get all of your benefits. We break that down into pieces so that you have access to it. And then we add value through things like uploading your ID cards, looking at an HR calendar, click to call, contact forms, things like that. And we'll be showing that to you in a demo here in one minute. You have access to your benefit guides. These are always up to date. Plans may change year over year. The benefit app is always up to date. And then further, you have more information about your particular profile. Everyone should see my phone in front of the screen. We'll go through a quick demo and then we'll walk through the actual survey itself. So again, this is a sandbox environment where we're doing our development. We are launching this product with several clients next week, Jeanette being one of them. BenefitsApp is an easy name to remember. We help with your employees to know how to download it, but when I click on it, you'll see here that it actually does face recognition to log me into the Benefits app. So that quickly I'm into Benefits app. You see your company logo, you see your plan. For clients with multiple plan levels, it's specific to the employee. If an employee leaves, we can turn the Benefits app off. You see your status here. As I scroll down, we have quick links, we have your benefits, and we have other. We also have related contacts. So any eligible member within your census, be it a significant other or child, if they're on your plan, you see their information as well. They can download the Benefits app, have access to benefits and the survey as well. Within the program, we have certain features like contact your plan administrator, where in a HIPAA compliant, fully secure way, your employee can send you a message directly to your HR administrator or your plan administrator. They can upload a file. Again, instead of sending email with PHI, this is a fully secure environment. If I go back to home, I'll go down to, for instance, under benefits, I might see my benefit guide, and I could see my benefit information right within the platform. But more importantly, if I go to this COVID survey, this is the survey that you would see. And in a minute, I'll show you in the presentation. We send a push notification at the rate that you would like us to, and then you click in here and you've got survey instructions. If I hit the back button, I've got call the HR hotline, which will initiate a phone call. I've got other content. I can link to, say, the CDC website, and I could take my survey. So when I take my survey, we've got 7 CDC directed questions. In the last 14 days, have you traveled outside your normal routine? These are all yes, no questions that you go through and you answer. Have I had a fever? Have I done this? Have I done that? And at the end, you submit that form to the platform. Okay. I'm going to jump back to the presentation. From a workflow process, we work with your team to present a push notification to your employees. So every morning or per shift or however you want to segment it, we send a push message. A push message happens outside of the app. It says time to check in. Please take a minute to submit your COVID-19 health assessment survey. So that is, we think employees need to be reminded. So when they do that, they get a link right into the app where they're able to access the survey. Within the survey, we ask them, do you have a fever? You know, all the different questions, do you have any kind of symptoms? We go through the questions that are CDC driven. Anyone in your home or in close contact currently under quarantine or illness? Anybody that's been tested for COVID-19? Are you aware of any place that you've been that has reported a COVID positive? The last 14 days, have you traveled outside your normal daily routine? Do you have sufficient supply of PPE? Once you submit it, we run a formula that says, okay, if you have answered no to all the survey questions, they will get a green sign that says good for work. So it's visual and written, good to go to work. This again removes all the questions on the employee's part as, do I go to work or not? They will then receive a push notification the next day saying time to take the survey again. Again, all of this is configurable. If you want the survey to go out every other day, once a week, once per shift, we can do that. If they answer questions yes to question 6 or 7, then we give them a monitor symptoms. We then present to them based on the employer's needs, come to work, do not come to work. So if you don't have sufficient PPE, please advise of purchase or notify your employer. If you answer yes to question 6, continue to monitor health. Again, these are driven by the CDC. If the CDC changes, we will update our survey and the results. Lastly, you might get a stay at home or contact your physician. There are 2 different status levels for this. There's status level 1. If you say yes to questions 3, 4, or 5, we advise that you remain at home for 14 days and monitor your symptoms. We will not send a push message to the employee every single day for 14 days. They will remain red for 14 days, and at the end of 14 days, they will receive a message that says time to take your survey again. So the system is smart that way. There is a red status 2. Again, depending on how you answer the questions, it's remain at home for 3 days. Furthermore, in our webinar next week, we will discuss how people with red statuses or yellow could receive a phone call from a health advocate concierge saying, I see you have a red status. We're in a confidential conversation. Do you have other outlying issues? Do you have diabetes? Do you have health issues? And to help the employee understand how to resolve their symptoms in a way that doesn't spiral out of control. So this is a tool to help facilitate that whole process. So again, you've got good for work, monitor your systems, stay at home, and then we can modify the recommendations based on your particular needs. On the back end, you might say, okay, so my employees are doing this in a sustainable, repeatable way. On the back end, since it's salesforce.com, we have a BenefitsApp portal for the human resource officer. There you will see 2 things. You will see a dashboard that will give you the results of the survey. This survey is pretty dire here. We have 24 good to work, 35 monitor systems, and 66 stay at home. So this would actually reflect on a regular basis the survey results for your employees. Further, we can tell you how many employees are in a red status, say by age or by location for those with multiple locations. We can also show you a dashboard component by time that you can click on, and it will show you the details of that dashboard component. All this information is kept in a HIPAA secure environment, and you have access to at any given time. The other thing that you have access to is a click through to your particular contacts. So you'll see a tab here that says contacts. And if you click on that, you would see the individual's information. You'll see a list of your employees. You'll also see whether they are good for work, have access to their email address, their phone number, and the ability to reach out to them to follow up, because obviously we all care about our employees and we want to be able to connect with them and make sure that they're healthy. So that is the back-end component dashboard that you have access to, again, in a completely HIPAA compatible environment. I want to finish up the demo and introduce Jonathan Anders. Jonathan Anders has over 25 years experience in the employee benefits space. He's an ambassador in the industry. He's brought in as a consultant. He advises us. And so, Jonathan, hopefully you're still on the call there and could just make some comments about what we're doing here and what you've heard about in the industry relative to surveys and COVID and benefits and support.
Sure. Thanks, Rich. As Rich mentioned, I have 25 years of benefits plan management history and work closely with many of the experienced brokers out there in large groups. And so just my comments today are really more or less patterns that I'm either hearing or seeing out in the marketplace, and I'll, keep my comments brief. I think that, the challenge, the virus, the pandemic, however you want to categorize it, is both real time and unexpected. And as both Rich and Jeanette have alluded to, everybody is trying to figure out the best, repeatable, reliable process that they can develop and evolve for their own company needs. And so when I'm out talking to brokers and employers, I get a myriad of, perspectives and information. It's a lot of what right now, and very limited how. And so that's part of the challenge, is taking the problem and turning it into that repeatable process that Jeanette mentioned. And so by design, I'm the kind of guy that identifies risk and manage and mitigates and measures risk, and very process oriented. So, I think we're not the only one out there trying to do this type of thing and or surveys. There are also some feedback I got from a broker just this morning that there was a carrier that is looking to roll something out to support its clients. But her concern was that while it's all done in good faith and the spirit of conquering the virus and limiting disruption, the challenge becomes that they're only communicating to those that are enrolled in the health plan. And that's not necessarily 100% of the total employees population. And that was just one, broker's perspective. Who knows where rates are going to go with utilization, and if that carrier is not the one where the employer places risk and they move to another one, how does that disrupt the consistency and or the communication of tools throughout the employer population? So I think where BenefitsApp is different is that it's an agnostic solution, and it's where the you can place the employer in control of overall communication. And, I think it's important that while there are guidelines out there now, you've got information from the EEOC, you've got information from the CDC, and having a platform that's malleable enough that you can adjust if other information comes out is important. The aspect of customization. And, as Rich alluded to, there will be a webinar next week where we have connectivity with a partner that can offer additional support for the yellow and reds, specifically related to COVID. And that, relatively speaking, the platform is easy to implement, it's affordable, and it can be within your workflow and communication process within weeks. And so I think, some of the other things that I'm hearing out there, it's not just, can I go back to work? It's additional communication related around the pandemic and harassment due to national origin or race, and recommending employers, may want to communicate and remind employees of the company's anti-harassment and anti-discrimination policies. If an employer requires all of its employees to have a daily temperature check, can the employer maintain a log? And so it's just a series of workflows that we have to accept in this new norm. And so building and collaborating with clients in that environment enables us to build solutions inside the app. And I think lastly, all of this type of communication needs to be presented in the context of your own company with your benefits and your style. So, Rich, in closing, I'd say flexibility of design for defining engagement with employees and their dependents. Things like the inclusion of other employer-sponsored benefits and pandemic-related content, and the agnostic aspect of the tool allows employers to provide that consistent and reliable communication. Ideally, it's in conjunction with your total benefits offering. And it allows employers to provide communication and messaging effectively. And it's on the employee's daily control panel. So that's their phone. And if we're going to work in a remote environment and they can't walk down the hall and potentially ask HR questions, then that conduit of communication needs to be enhanced. And the daily control panel is something that we, set alarms when we go to bed to wake up, and the first, or second reference point that we have when we wake up. So we just felt this was the best conduit to enhance that communication with this new norm.
Thanks, Jonathan. I want to remind everybody that if they have any questions, please put them in the chat window. And I appreciate your comments, Jonathan. Two things. One is that we have a prospect that wants to roll out the survey, just the survey alone on the Benefits app, and then supplement it with benefits information for open enrollment later this fall. Benefits apps can evolve based on your particular needs. I wanted to let you know that we're constantly enhancing the product, features and functions, both internally with our partners. So COVID-19 check-in is, we are launching this next week. So you're getting a preview of it today. We are also on Monday releasing a digital signature product. So within the app, you can have employees legally sign agreements or just simply sign a document that says with their finger that says, hey, I've read the employee handbook or an ethics policy. I tend to think that that ability to agree to things on the app just makes it easy for employees. This summer, we'll be also launching a video chat feature so that right from the app, your employees can connect and have a video conversation in a secure environment with your HR administrators. Again, supporting this work from home, work remote environment. And then we're looking at wearables integration that would allow us to do things like connect to an iPhone, Google Watch, or a Garmin device. Again, leading potentially to allow employees to say, yeah, you can, I don't mind if you know what my temperature is, or, all again in a HIPAA compatible environment. So with that, there are new features coming out all the time. You can download the Benefits app right off the app stores. And if you're interested, we'd be happy to share with you a demo version. You do have to log in, and it is secure. Lastly, I just want to say thank you for everybody attending. Want to alert you to the fact that we're going to continue this discussion. Next week, we will have the CEO of TouchCare, which is a health advocacy company, online for the next webinar on how do you close the loop? If your employees need support, how do you help them? And they do everything from bill review to setting up appointments with physicians. And they have just, again, this week announced that they can prescribe for COVID-19 antibody blood tests through major blood test providers. So this is all happening very rapidly. We're trying to make the connections. I guess one question that's come in is, how quickly can the app be deployed to my employees? We typically find that an app can be deployed for the COVID-19 survey. That could happen by the end of next week. We do full service. So you are assigned an engagement manager who collects all of your content. We have an automated process for getting a census file from you, which is either spreadsheet driven or connected into your HRIS system. We collect all that, and then your employees simply need to download the app, register with your company code and an employee ID. If employee IDs are available, great. If not, they can just use their last name and typically the last 4 of their social or some other identifying ID. And then they have full access to the Benefits app and can do this. Another question is around push messages. So push messages go to the phone. If the Benefits app is installed on the phone, people can receive a push notification from you. It happens outside of the app. And when they open it and they click on it, it launches the app and takes them right to the survey. A text message, you need to know the person's cell phone number. We do get the cell phone number as part of the registration process for 2-factor authentication. We do push messaging and then in-app messaging, which is when you launch the app, you get a message there as well. Okay, there's some other questions that are coming in, but I want to be respectful for time. There's one other question. Is there a web option if there is no mobile phone? Right now, everything pushes through the mobile app. The HR portal is a web portal, and you can log in directly there. All other users go through the mobile app because there are app-specific features. For instance, the showing my ID cards is native to the app. So that is all. We try to push people to the app for that purpose. So with that, I don't see any other questions coming through the chat. Thank you, everybody, for attending. We will be inviting those that attended today, as well as other folks, to our next webinar. If you know people that you think might benefit from this discussion, please feel free to have them register as well. Everyone is invited as we try to provide a consistent, repeatable, sustainable value to our clients and their employees. So thank you very much, and we'll be finishing up